As we pass through life, we come upon obstacles in our path. The measure of a person is how those obstructions are engaged, rather than the outcome of the struggle. Many of his era let their struggles define them. Dr. James Reed met his obstacles directly and forged them into opportunity. Even though he was born in a shanty in a migratory labor camp in Pahokee, Florida, and his father died when he was only 6 months old, he was the first member of his family to graduate high school and to go on to college. He rose to the rank of colonel in the United States Army and received his medical degree from Howard University College of Medicine. He wouldn't allow his circumstances to define him, nor does he allow his patients to define themselves by their obstacles.
You kind of forget in some cases that he's your doctor because he's talking to you about your life and about your lifestyle and your health, and he's discussing it holistically.
James W. Reed, MD, Professor of Medicine and Associate Chair of Medicine for Research at Morehouse School of Medicine and Chief of Endocrinology at Grady Memorial Hospital, is a testament to rising above the expectations of others and of a certain time in history.
Oh, I definitely think that Dr. Reed has been a groundbreaker, and he's been willing to serve. So whether it's caring or knowing or doing, he's sort of been on the front line. He's a very special person.
He's a rare breed. I mean, you don't find people who love what they do and do it well, but stay in it because they just have integrity.
As a member of the Endocrine Society, the American Diabetes Association, and the American Society of Hypertension, James Reed has published and lectured extensively on issues relating to the diagnosis and management of diabetes and hypertension.
His work in endocrinology, his work with hypertension, and especially blacks and hypertension and diabetes, has certainly been on the cutting edge. He's written, I believe, 3 books dealing with these issues. He's taught about them, and he's taken care of patients.
There was a complex patient case that we had in clinic, and so I just remember him just, I gotta find an answer for this patient, I gotta find an answer for her.
I know that his patients have always thought very highly of him and have also always recognized the extent to which he cared about them and their condition.
Dr. Reed travels on behalf of the group he helped create, the International Society of Hyperthyroidism in Blacks. His travels for that organization take him to such places as Kenya, Brazil, Cameroon, and Australia.
In my role as director of the CDC and Surgeon General, I've been a lot of places. But when I heard him talk about where he's been with his family and the things he's done, I never would have guessed that he was such a well-traveled person and knew people all over the world. He's so humble until you wouldn't think that.
Dr. Reed declares himself dumbfounded to be receiving the Senior Sage Award. He says he never in his wildest dreams thought that Grady would award him anything.
I think it's just like Jim Reed to say that and to be dumbfounded, because I think he is not the kind of person who holds himself in the highest esteem. So he's been a leader, and regardless of what he says, he's always been out front. And we have been very fortunate to have him out front.
First, he's a person, and what I appreciate about him is that he sees me as a person, not just, the faculty member. He understands the work-life balance.
He's just done his job very well, and he's done it with an attitude of caring and commitment. We benefited from that. Grady has benefited from that. And so this is a great night for James Reed and his family and for all of us.